I had never heard of screening for colorectal cancer before my diagnosis. It was the last thing on my radar screen.
I feel so stupid not being more proactive. I could have avoided this cancer.
And this needs to stop. I mean, it's ridiculous. Colon cancer is one of the most preventable cancers.
You go there, you get the polyps out, and that's it.
It's such a pity that people are still even dying from it.
Take your health into your own hands and believe it. Don't be like me. I believe nothing could touch me. Everybody else could die and get diseases, but not me. And I found out the hard way.
My kids now have to be screened because their dad, was diagnosed with colorectal cancer. So because it's a hereditary disease, both my son and daughter will have to be monitored.
I want to be there so that people aren't making the same mistakes I made. That they're aggressive, they're proactive with their health, and particularly with colon cancer, because it's so preventable. I got symptoms, pretty radical symptoms. I was bleeding. I had pains and so on.
When when the doctor found out I had the issue with my blood, I was referred to a surgeon, and a few days later, I was scheduled for a colonoscopy.
What led me to having a colonoscopy was the knowledge that my family possibly had a hereditary syndrome that caused colorectal cancer. And I was advised by a geneticist to go ahead and have a colonoscopy.
The surprising thing about it is that there are many symptoms before even getting to stage 4, but he didn't experience any of them.
I was rather fortuitous because the symptoms that I had of rectal bleeding were exacerbated by a medication I was on, so I ended up having the bleeding more profound and more profuse than otherwise would have been the case.
By that time it had gone into her ovaries and had gone all over, and at that time I probably didn't know the questions to ask, and I didn't know it probably had gone into her liver and lungs also.
He was feeling rather bloated and very lethargic, and wasn't able to eat. In 2 weeks he might have eaten enough food to fill one breakfast bowl throughout those 2 weeks. And then he started having severe lower right pain.
Right from the beginning, the doctor kind of came out and said, well, she doesn't have that much of a chance.
I was operated on in Stratford.
Removing the primary laparoscopically, which was 3 small incisions.
Had emergency surgery to put an ostomy on her.
He had his colon cancer surgery.
He basically started off with chemotherapy. It was Folfox and Avastin.
13 rounds of chemotherapy with a biologic drug called Avastin.
I brought her treatments, I brought her to chemo that failed.
Then we switched to Xylota, that didn't really help at all. And then we switched to Folfiri.
He had developed kidney stones throughout his chemotherapy. We had to deal with those.
Had 65% of my liver removed by the surgeon.
Basically got his whole colon removed and a lot of other tumors that were on his lungs, his liver.
And the recovery from that surgery was somewhat longer than the primary surgery. It took about 6 weeks.
And he just got worse after 4 months. The surgery didn't really help him. It made him weak and skinny because he had no more colon, so he was having a lot of digestion issues.
We're talking about a recovery of 3 months. What am I going to do? How am I going to pay the bills? And all that type of thing.
I proceeded to have another 8 rounds of chemotherapy.
He was able to undergo another treatment.
I had follow-ups every 3 months.
Assuming that there's a successful outcome, you're probably into this for 2 years of treatment and somewhere in the order of 3 to 5 years of follow-up. So lots of scans, lots of doctor's appointments.
He was a healthy man, barely ever went to the hospital or ever been sick, ate healthy, done exercise.
I hiked all the years and I swim very actively, and up until the time I went into hospital, basically I was swimming a kilometer 3 times a week.
My future was in question. Didn't know if I was going to live to survive and see my 2 young daughters, Amanda and Kathleen, who were aged 4 and 2, if I would see them grow up and get married, have children of their own. Would I grow old with my husband Andrew? Everything was a question all of a sudden. It was like my life was out of control.
So I really, after that, I didn't want to see another hospital. I lost my interest. I said I have to go on and I have to basically, I think, heal myself because I became an emotional wreck during that time.
She'd be at the restaurant with him and he'd keep having to go to the bathroom because he had a lot of digestion issues. And she would be on the table all alone and say, this is how it's going to be for the rest of my life. I'm not going to have him with me. He's not going to be with me anymore. And she's the one who breaks my heart the most. Honestly, I hope nobody has to live the pain she ever did. You know, everyone expects to lose a dad. So we come to terms with it at an earlier age that one day our parents are going to die. But, you know, for my mom, it's her husband, it's the love of her life.
I had to create a new identity. My identity when I was married, because my husband and I were together from the time we were 17 years old and grade 12 in high school. So our identity as we grew older together was one another, and we could finish one another's sentences. I know that sounds corny, but we were a unit. We were pretty tight, and then to have that part of you gone, because it is a part of you, I had to figure out who I was and what do I represent. I'm not a wife anymore. Suddenly I have a new title. I'm a widow, and my kids are without their dad, and those kinds of things are things that you don't think about during the journey. You do think about, oh my God, what if something happens to Paul? You know, what will I do? But you kind of muster up some strength, but you still miss him every day.
The Colorectal Cancer Association sponsors a number of initiatives for patients, such as myself. There are support groups which are invaluable. It's great to meet once a month with folks that have been through or are going through what you're faced with. One of the great fears is the fear of the unknown, and knowledge is really extremely important in knowing what the options are, because you can spend hours, you can get your medical degree on the internet. It doesn't necessarily tell you what you need to know. So CCAC has cancer coaches, which folks who help you navigate through the various chemo regimes or the various surgical options or other treatment options. They help you understand what you're going to deal with. They help you secure second opinions if that's what's necessary. So they do a fantastic job on really reducing that fear of the unknown.
Colorectal Cancer Association of Canada was one that we found on the internet. We were just, you know, when you're diagnosed with something as serious as cancer, you kind of take everything in your control to try and find something that's going to help you. And we did come across the Colorectal Cancer Association of Canada. They immediately sent us information by mail, sent us their, information through email and so forth.
The Colorectal Cancer Association came onto my radar screen when I was struggling with trying to understand how the body recovered from surgery. And because I was interested in swimming and doing those other things, I was more concerned with restoring my core. And I stumbled on the Colorectal Cancer Association's website, and the next few minutes I found myself talking to Mary Stein.
I went to the website, and the website was my comfort during my recovery. I was looking up forums, how other people were coped with it and the recovery.
They were so sympathetic towards my dad passing away. They all sent me condolences, emails, and they really helped give me the strength to go on and help others.
I spoke to a lady called Antoinette, and I said, Antoinette, I need to help, I need to do something. And she said, well, we want to get screening in New Brunswick, and the health minister hasn't allowed that, and so forth. So I was able to make a connection with the health minister. We were able to set up a minister's meeting, and colorectal cancer was passed that day. So that was a new beginning for New Brunswick and for for newly diagnosed colorectal cancer patients, that now anybody over the age of 50 could get screened. So that was a good thing. Subsequent to that, I went to Prince Edward Island when Mr. Stein and other members of the Colorectal Cancer Association of Canada went to try and encourage that government to pass colorectal screening in that province.
I'm a cancer coach, and I do talk to folks that are going to be experiencing some of the surgical techniques and procedures that I've had.
I have an interest in trying to help others through who has experienced in the same situation.
I'm here now because I want to become a cancer coach. As I said before, I want to help people, and I want them to know that there is hope.
But just telling folks what I've went through and the fact that yes, people do survive and people do come out the other end somewhat better for the experience, not necessarily worse for the experience, is important, and it helps folks deal with treatments.
And if I can give anybody hope, then I'll consider Paul's death not in vain.
I also do a support group now, and I'm opening up a new support group come August.
I want to help spread the word about colon cancer screening.
I'm interacting with people all the time, and I come away from those conferences, and even if I just touched one person, I said, maybe that person, I'm helping him and maybe saving his life.
And I already did 3 volunteer opportunities where, just talking to people about colon cancer, and I felt I already made a difference in a few people's lives, and I just started, and it's just so satisfying.
Where somehow I can make a difference with them, and that's what it's all about.